UV disinfection for nursing homes and assisted living. Prime candidates for GUV. Nursing homes, assisted living facilities, and senior centers, places where elderly people are given medical as well as personal services, are all prime candidates for ultraviolet disinfection. According to the CDC, 1 to 3 million infections are contracted each year in these types of environments, many of them resulting in death. UV disinfection is an excellent addition to the standard cleaning and disinfection methods that these institutions already implement. The Institution of Engineering and Technology declares that ultraviolet germicidal irradiation technologies have emerged as a promising means of surface disinfection in hospitals and other healthcare settings. In the last 100 years, scientists have discovered that UV light is an effective, chemical-free method of inactivating the many bacteria, fungi, and viruses which thrive within the interiors of long-term healthcare facilities for the aged. While urinary tract infections and pneumonia are the most prevalent infections in nursing homes, the germs leading to these infections, influenza, C. diff, Staphylococcus, norovirus, SARS-CoV-2, and others, are extremely vulnerable to the powers of ultraviolet light. Even chlorine-tolerant organisms like Giardia and Cryptosporidium, contaminants frequently found in water, fall prey to the appropriate dose of ultraviolet disinfection. Emitted at a wavelength of 254 nanometers, germicidal UV light successfully prevents microorganisms from replicating. It attacks critical links in their DNA strand, making them unable to proliferate. Ultraviolet Corporation manufactures numerous models that deliver this destructive light to pathogens on surfaces, in the air, and in water. Medical centers across the world are already benefiting from this innovative means of disinfection. Surface contamination. Nursing homes and assisted living facilities are prone to infection, with the threat of HAIs, healthcare-associated infections, lurking around every turn. Bedside tables, chairs, and TV remotes can carry germs and must be treated. Light switches, door handles, outlets, and anything that is prone to the touch of a human hand can host germs. IV poles, patient tables, and medical devices like vital sign monitors and workstations can harbor germs as well. Elderly patients are prone to skin squames or the normal shedding of skin flakes, which can carry germs. As they fall and cling to the bed rails, bed sheets, blankets, mattresses, and floor, they could infect guests or staff who routinely touch these areas. Bathrooms can be an even greater source of infection. Sinks, soap dispensers, and toilets are all danger zones, as they are touched prior to any washing and can splash droplets. Personal showers can spread contaminated aerosols from the sprayers and harbor germs in corners and on tile grout. Sinks can pose an even greater risk of infection if they are wrongly used to discard patient waste. E. coli, Pseudomonas aeruginosa, Serratia marcescens, Legionella, Acinetobacter baumannii, and Klebsiella pneumoniae are bacteria which have been linked to infections from these sites. UV surface disinfection can neutralize them on water devices, fixtures, and drains. To treat contaminants on all these surfaces mentioned, we have created the Sanidyne UV Portable Sanitizer. Simply carry or roll the unit into the desired room and program the exposure time. With 4 or 8 lamps, it will emit lethal UVC light in every direction, wreaking havoc on any microbial DNA within its sphere of influence. To avoid personnel and residents being exposed to direct ultraviolet rays, Sanidyne must only be used in unoccupied spaces with caution signs posted at all entrances. If someone accidentally enters the room during a treatment session, occupancy sensors will detect movement and shut off the unit. Medical tools and instruments, grooming devices, and any other small objects found in senior centers can be disinfected in our innovative Sani UV Cube. Place the objects you wish to disinfect into the sizable chamber and watch through the protective window as UVC light disinfects them. Air contamination. Airborne pathogens like tuberculosis, COVID-19, influenza, and the common cold are responsible for outbreaks and thousands of deaths each year, mainly among nursing home patients 65 and older. UV disinfection can significantly reduce harmful bacteria and mold present in your long-term care facility. Hygiair indirect air disinfection models project UVC rays across upper room air currents, destroying bacteria and viruses that are carried into its ultraviolet field. Models can be mounted 7 feet or higher on the walls or from ceilings of patient rooms, public areas, waiting rooms, and operating rooms. Perfect for nursing homes and assisted living facilities, the Hygiair is a highly effective model when it comes to disinfecting air within an occupied room. Upper room UV disinfection had the lowest cost per equivalent room air change when compared with other room air cleaners. It is also found to be nearly 10 times more cost-effective than mechanical ventilation. Sanitaire is another UV disinfection model designed for occupied areas. It uses a blower to constantly draw air into its reflective exposure chamber, subject it to ultraviolet light, and release it back into the space. Models are available for wall mounting, ceiling mounting, or mobile use in various room sizes. HVAC systems are necessary in medical buildings. Unfortunately, the fans that help circulate this conditioned air throughout the facility are giving microbes a free ride from room to room as they seek new hosts to infect. Duct surfaces and condenser coils can harbor pathogens. Our AirLogic safely installs at strategic points right within the air duct system where contaminants thrive, exposing them to lethal ultraviolet light. This practice attacks them before they have the chance to be released into rooms through air vents. Water contamination. Water can be disinfected at 2 places within a health facility: point of entry or point of use. Point of entry models can neutralize microbes of concern in facility-wide water systems, including Pseudomonas, Serratia, Acinetobacter, Klebsiella, and Legionella. UV water disinfection can render them harmless in water service lines, either right before the point of use or at the building's point of entry. Watch our medical water video for more information on implementing UV disinfection as part of a facility-wide water management program. Click the link in the top corner. To treat all the water entering a building at the point of entry, Megatron and Sanitron are excellent options, depending on the structure's volume needs. Hooked directly into the plumbing after filtration, softeners, and other treatments, microbes are neutralized with germicidal ultraviolet light. As a secondary disinfection point, installing our Biologic, Mini Pure, or Mighty Pure models at the site of sinks, bathtubs, showers, and hydrotherapy pools will treat water in the line immediately before the point of use. Both residents and staff can then turn on the faucet with confidence, knowing the water has been sufficiently disinfected with germicidal ultraviolet light. Ultraviolet disinfection works. With over 5 million Americans residing in long-term care facilities at any given time, the problem of pathogens will always exist. Elderly people in these institutions will always require a higher level of protection against life-threatening illnesses. Trust in these viable ultraviolet solutions from Atlantic Ultraviolet Corporation to thwart the presence of harmful microorganisms in nursing homes, assisted living facilities, and senior centers. Our products have been improving lives for over 60 years and will continue to do so for many years ahead. Call one of our specialists today for assistance in implementing an ultraviolet disinfection strategy in your facility. Atlantic Ultraviolet Corporation. Contact us today.